Have you ever looked down during your period and felt a little flash of panic because the color wasn't what you expected? Maybe it was darker than usual. Maybe it was lighter. Maybe it was a shade you had never seen before and you had absolutely no idea what it meant. Most women have been there, and most women have done exactly the same thing: closed the browser tab, pushed the thought aside, and got on with their day. Today, we are not doing that. Today, we are talking about every single period blood color, what each one means, what causes it, and when it is simply your body doing its job versus when it is your body asking for help. Your period is one of the most powerful health indicators your body has, and the color tells you more than you might think. Before we go through each color, it is important to understand something. Your period blood color is not fixed. It changes throughout your cycle, and it can change from cycle to cycle depending on your hormones, stress levels, age, diet, and overall health. The color of your period blood is determined by how long the blood has been sitting in the uterus before it exits your body. Fresh blood that moves quickly is bright and red. Blood that has been sitting longer oxidizes. It reacts with oxygen and turns darker, brown, even black. This is completely normal. Understanding this process is the foundation of everything we are about to cover. Let us go through every color one by one. Bright red. Bright red period blood is the color most women associate with a healthy period. And in most cases, that association is correct. Bright red blood means the blood is fresh. It has moved quickly from the uterus and has not had time to oxidize. You will typically see this at the start of your period or during your heaviest days when the flow is strongest. Bright red blood throughout your entire period, from start to finish, is completely normal for many women. When to pay attention: if you are experiencing bright red bleeding between your periods, not during your normal cycle, that deserves a conversation with your doctor. Spotting between periods can sometimes indicate hormonal imbalance, cervical irritation, fibroids, polyps, or in some cases, infection. Bright red blood during sex is also not something to normalize. We have a separate video on that. Check the link in the description. Dark red. Dark red period blood is also completely normal and very common, particularly at the beginning or end of your period. Dark red blood has spent a little longer in the uterus before exiting. The slower the flow, the more time blood has to oxidize, which darkens its color. This is simply biology doing its job. You will often see dark red blood when you wake up in the morning after lying down for several hours. Blood that has been collecting overnight comes out darker. That is nothing to be concerned about. Dark red blood at the very start of your period, before the flow picks up, is also perfectly normal. Your body is essentially clearing out what was left from the end of your last cycle. When to pay attention: if your entire period is consistently very dark red and accompanied by large clots, severe cramping, or a particularly heavy flow, that is worth discussing with your doctor. It can sometimes be linked to conditions like endometriosis, fibroids, or adenomyosis. Brown. Brown period blood is one of the most common sources of anxiety for women and one of the least concerning colors in most cases. Brown blood is simply old blood, blood that has spent the most time in the uterus and has oxidized significantly before exiting. The longer blood sits, the darker and browner it becomes. You will most commonly see brown blood at the very beginning of your period, when your body is clearing out the remnants of your last cycle, or at the very end when the flow is slowing down and blood is moving more slowly. Brown discharge in between periods can also be completely normal, particularly around ovulation or in the days just before your period arrives. When to pay attention: brown discharge that comes with a strong, unpleasant smell, itching, burning, or pelvic pain is worth investigating. These additional symptoms can indicate bacterial vaginosis, an STI, or another infection that needs treatment. And if you are pregnant and experiencing brown discharge, always mention it to your doctor or midwife, even if it turns out to be nothing. Better to ask. Pink. Pink period blood happens when fresh red blood mixes with cervical fluid, the natural discharge your body produces throughout your cycle. The dilution lightens the color from red to pink. You will most commonly see pink blood at the beginning of your period when the flow is very light, around ovulation when cervical fluid is at its highest, or in very early pregnancy as implantation bleeding. Pink blood is also common in women who are approaching perimenopause, when estrogen levels begin to decline and periods naturally become lighter. When to pay attention: consistently pink or very light periods over several cycles can sometimes indicate low estrogen levels. This is particularly worth noting if you are also experiencing other symptoms like vaginal dryness, fatigue, low libido, or irregular cycles. Significant weight loss, overexercising, or high levels of chronic stress can all cause estrogen to drop, which can lighten period flow and turn blood pink. If your periods have recently become much lighter and pinker than they used to be without an obvious explanation, mention it to your doctor. Orange. Orange period blood is one of the colors that deserves the most attention, and it is the one most women know the least about. Orange blood happens when red blood mixes with cervical fluid, similar to pink blood, but the resulting color is more orange than pink. A light orange tinge at the very start of your period can occasionally be normal. However, orange discharge or period blood that is consistently orange, particularly if it comes with any additional symptoms, is worth investigating. Orange discharge can be a sign of bacterial vaginosis, a bacterial imbalance in the vagina. It can also indicate a sexually transmitted infection, including trichomoniasis, chlamydia, or gonorrhea. Both BV and STIs can cause discharge to take on an orange or yellow-orange color. When to pay attention: if your blood or discharge is orange and accompanied by an unpleasant smell, itching, burning, or unusual texture, please see your doctor. These are not symptoms to push through. Unlike brown or dark red blood, orange is not a color that is easily explained by the oxidation process. It warrants attention. Black period blood looks alarming. We understand why, but in the vast majority of cases, it is completely harmless. Black blood is simply blood that has taken the longest to exit the uterus. It has oxidized so completely that it has turned from dark brown to black. You will most commonly see it at the very beginning or very end of your period, when the flow is at its slowest. Think of it as the oldest blood in the queue. It has been waiting the longest, and by the time it exits, it has turned completely black. That is all it is. When to pay attention: black discharge alongside a strong, unpleasant odor, unusual texture, pelvic pain, or fever can occasionally indicate a blockage in the vagina or cervix, a condition called hematocolpos, which prevents blood from exiting normally. This is rare, but it does require medical assessment. If you regularly see black blood throughout your entire period, not just at the start or end, and it is accompanied by heavy cramping or other symptoms, mention it to your doctor. But if you see black blood for a day or two at the beginning or end of your cycle with no other symptoms, take a breath. It is almost certainly just old blood. Gray is the one color on this list that is never normal, and it is the most important one to know about. Gray discharge or gray-tinged period blood is almost always a sign of infection, most commonly bacterial vaginosis. BV happens when the natural bacterial balance in the vagina is disrupted, allowing harmful bacteria to overgrow. Gray discharge is one of its most distinctive symptoms, and it is often accompanied by a strong, fishy odor. Gray discharge can also occasionally indicate a miscarriage, particularly if you are or suspect you might be pregnant. Tissue passing during a miscarriage can sometimes appear gray. What to do? If you notice gray discharge, do not wait. Book an appointment with your doctor or visit a sexual health clinic as soon as possible. Now, let's bring all of that together into something simple. A traffic light guide you can actually remember. Green. This is normal. No action needed. Bright red during your period. Dark red at the start or end. Brown at the beginning or as it finishes. Even black at the start or end can be completely normal. Amber. This is your cue to pay attention. Pink blood that keeps showing up cycle after cycle. Orange blood, especially if there are no other symptoms. Or, honestly, any color that is a clear change from what is normal for you. These are worth monitoring and mentioning to your doctor. Red, this is when you need to seek medical care. Gray discharge, always. Any color with a strong smell, itching, burning, or pelvic pain. Bright red bleeding between your periods. And any bleeding during pregnancy. Your period is not something to be embarrassed about, and it is definitely not something you should suffer through in silence. It is information. And now you know how to read it, subscribe, Real Women's Health, no shame.